We brought together stakeholders from the entire breadth of the oncology community to talk about immuno-oncology and how it affects each component of that community. And we had a terrific discussion broken into several segments about what's happening in terms of immuno-oncology's effect on policy, on payment, on how we're delivering drugs, on value-based medicine and value-based reimbursement, and how immuno-oncology falls into that.
One of the greatest value of having meetings like the meeting that we're having today is the diversity of the individuals who have been selected to join this meeting. We have payers, we have medical oncologists from large academic centers, we have oncologists from community hospitals, we have the government, we have the FDA, we have the nonprofit organizations.
I think the two things that really struck me as consistently being mentioned by all of the diverse participants in today's conversation were the need for really robust data analytics. The other is that there was a broad sense that as we move towards a value-based world where we are going to be judging healthcare on the quality as opposed to the quantity of care, that we need to have agreed upon measurable, disseminated, patient-reported outcomes measures that can truly measure the quality of the care that we deliver.
There's a lot of issues we still have to deal with in terms of how we make sure patients are going to have access to these drugs and these therapies, and how we're going to pay for them, and that as we shift the models of how we pay for care, that we're not creating disincentives for patients to receive the treatments that they need.
So it's very important that we really hear what everyone is worried about, we hear what everyone is trying to solve, and then at the end, jointly, we can come up with a solution based on the collective input that we're gathering.
How do we get patients who deserve this therapy to get that therapy, and how can we do it in a way that's sustainable? And we have to make it sustainable. Immuno-oncology drugs are, we talked early in the day, they're expensive. There are over 1,000 trials ongoing. Combinations, I think the group as a whole felt, are going to be the future, which will increase the cost even further, but will also increase the efficacy of the therapy. So how do we make that work? And we're trying to figure out how we measure quality, how we improve the patient experience. There was a lot of discussion around the patient experience and what patients value when they're getting therapies for cancer, and how we make that more cost effective. We're moving to new payment models, alternative payment models that are based on risk sharing, and that providers and groups will be assuming more of the risk, which is probably good for patients in the sense that it's closer to the patient decision making. The provider and the patient together will make informed decisions on what's best for the patient.
I think there's clearly a revolution in cancer care. Immunotherapy is in the clinic and it's here to stay. It's really transforming the practice of oncology. The kinds of drugs that we're using are very different than the ones we were trained to use. How they work is very different. The side effect profile is very different. So education is really critical, both of the patients and their families, as well as providers out in the community.